Welcome back to She's Got Game. On this week's episode, I'm sitting down with women's health specialist and osteopath Anj Emmerson. We're talking about all the different stages of life with women, particularly postpartum and when we get into that state of perimenopause and postmenopause too. But it's not only just about women who are going through that stage of life, we're also talking about what it's like for teenagers, from incontinence, pelvic health, what pelvic floor strength actually means, and how you can improve your own. Let me know what you think of this week's episode in the comments below. I hope you enjoy. Anj, welcome to She's Got Game.
Thank you for having me.
Thank you for joining me. What is your favourite body part to treat?
I think this is a hard one because my favourite body part changes. It's quite phasic. At the moment, I would say it's the abdomen. So I like sort of keeping up with current information and revisiting sort of where I was at when I first started 16 years ago. And at the moment, the abdomen fascinates me again. It encompasses the diaphragm at the top, the pelvic floor at the bottom, the lower back at the back, and then the abdominal wall. And I think when it comes to sort of treating back pain, if we were to use that as an example, it's overlooked. So I was mentoring like a young osteo the other day, and he was like, "Oh, I would never think to go to the abdomen if I had a patient with back pain."
Interesting.
And I was like, why not? My God, that encompasses so much. If people are holding themselves a certain way, like those muscles at the front are structurally integrated to keep that whole corset in place. So for me, that is at the moment my number one top space to go.
And when people refer to the core, can you explain what the core actually is rather than it just being those kind of superficial abs that everyone sees as a six-pack? What are we referring to when we talk about the core?
I mean, the core is the center of balance. So for me, I like to visualize it as a box. So the pelvic floor being the basement of that box, the diaphragm being the top of that box, the side obliques, and then the sort of front panel, you know, you've got your rectus abdominis, your transverse abdominis, and your erector spinae at the back. But all of them have to work in synergy. And I think I don't really like using the word dysfunction, but when there is weakness or injury or in one of those areas, I do think everything fascially gravitates towards it. So there might be a pull in their rib cage, there might be, you know, their pelvis holding themselves towards one direction, their breath mechanics might not be functioning a certain way. I think all of it integrates to that core. And then you can break it down into loads of different parts and get more complex with it. But the organs are within that, and then everything that just kind of holds it together like a corset.
What is the first thing you notice when someone walks into your clinic?
I think the first thing would be their body language. If it's a first consultation that I'm seeing them, I've not met them before, it's how they're holding themselves. I think that tells you quite a lot. And my job is to make them relax. So before I go into like, oh, anatomically, their shoulders up, or, you know, they've still got their clothes on, I haven't gotten them down to their underwear and assessed them. I'm essentially just seeing, is this person breathing a certain way? What's going on with their eyes, their facial muscles? Are they able to relax? That's my goal. So energetically, I'm just sort of seeing, what are they bringing into the room? And for me, that's quite important.
I mean, the first bit of homework you gave me when we met 5 years ago was to slow down. Nothing to do with my body.
That's not everyone's homework. I think that was just you.
That was quite particular. And we've slowed and we're doing better now. What is the most unusual thing you've ever used as a treatment tool?
I don't know. I think that's quite hard to... Because I use my hands. I'm a manual therapist, and I know lots of other therapists use quite a lot of gadgets. Yes, there's dry needling and there's lots of things like that. Oh, we do sometimes do a lot of testing, and there's a patella hammer, which is sort of used to do various like reflexes, particularly at the knee, the elbow. And I didn't know where my kit bag was. It just kind of got my stethoscope and stuff to kind of look in the ear, and I didn't know where it was, so I used my yogurt spoon.
I used to do that to my dad. I'd make him cross his legs and hit him with a spoon on the knee,
same
which
thing.
is jerk. Yeah. Love that. What is your music of choice whilst treating?
Similarly, it's variable. It's really dependent on my mood, but I also need to create an ambience for people to sort of get their parasympathetic to relax. So I don't like well music. That's not my choice. But for me, it's at the moment indie soul. I can never pronounce the name. Karangavin, like the Texas soul, is definitely my go-to. I love being fluid as I treat. And so if there's music that adds that fluidity, I'm down for that.
I love that. Listen to your body. How important is this, and when does it become a problem?
Listening to your body is vital. I think when you lose sense of self, that's when problems occur. I think intuitively people always know what's going on. My goal is to help them sort of come back to that. But listening to the body, how you're breathing, how you're holding yourself, pain, like what are you experiencing? What are the symptoms? All of that's really vital, I think.
And has it ever got to a point, I want to touch on pain, where sometimes people say pain becomes slightly more psychological than the actual pain itself, where it's almost like you're so used to feeling a certain pain that even once you're recovered, you're still feeling it. At what point does that tend to occur?
I think pain and the neurological sense of, like the psychological side, is very interlinked. Chronic pain and acute pain, you've sort of got two different aspects. Acute, someone comes in, they're very much feeling what they're feeling, and their body's in fight and flight, and they're desperate for you to get them out of that situation. The chronic pain is what gets a bit more complex. You know, there's often depression, anxiety, a state of fury as well, that they've been in this state for such a long time, perhaps tried various modalities that haven't solved or cured, if there ever is a cure, for their ailments. And it's really difficult to kind of narrow that down as to how to help them. I think sometimes it isn't just me as a therapist. It would be if they're seeing a personal trainer, if they're seeing a psychotherapist, you know, how is their pain modulated if they're on pharmaceutical drugs, if they're on antidepressants. You've kind of got to really break that down for the individual, and then maybe do some SMART goals as to what their aims are in a treatment and what they might want to, in a short space of time, unblock, and then long term, what are their goals? Because it's not so linear, you know, and your experience of pain and mine is going to be totally different because it's so subjective. Our perception of pain, it's such a complex, I mean, that's why people go on loads of degrees of understanding it. The complexities of it are pretty full on.
And when it comes to women, are there certain points throughout our menstrual cycle where our pain tolerance is higher or lower?
Absolutely, I'd say, but then equally this varies. You talk to, you interview 50 women, their experiences will be totally different. But classically, hormonally, there's periods like physically in the cycle where someone might be more prone to injure themselves. There's more elasticity because of peaks in estrogen and progesterone. Estrogen is essentially anti-inflammatory, but with some women, they can continue to do whatever they need to do and experience very mild symptoms. And for others, it's incredibly debilitating. And I think it's looking at what are the other stresses, like what is their cortisol management in reflection of everything, you know, what's going on with the lead up to them having day one of their menstruation. What can they potentially do to tap in, knowing that they're going to be experiencing a certain way, like be it diet from an inflammation point of view, be it recovery, rest, maybe not pushing their body as much so the inflammatory markers are a little bit more plateaued. What can they control? Because there's a lot you can't with pain, right? So what you can control, if you're able to kind of tap into that, I think would be really useful at various phases of the menstrual cycle. Because equally, like, there are moments in the cycle where you're at your best and you want to tap into that and get the best workouts, your skin's amazing, everything feels fantastic. Like, that is where you're thriving, to push yourself, to assert yourself a certain way. And if your job allows, you just slow down when you want. So
we're going to come on to more of this later. What's the strangest thing you've ever had to tell a patient not to do?
So as you know, my role is women's health based. So I can't say it's the strangest, it's become my norm, but we do deal a lot with sexual injuries in the bedroom. We have to kind of delve into that as to how I can best help them. So I wouldn't say it's strange. It's really good having platforms like this where we can normalise discussions like that. Because I think women sometimes are very, not all, but, coy about sort of how to best help themselves and what's my role in facilitating that. But I don't think I can answer that because it's...
Nothing strange.
No, I think everything has to be made... It's an open dialogue. I can't make it out that it's strange. Everything's open and accessible, and my job is to facilitate them through it.
I love that. What's one piece of misinformation that frustrates you about women's health or fitness?
Misinformation. I don't know. Women aren't strong enough. Like, during your menstrual cycle, you have to rest. I mean, I know what I said before, but that's not always the case. Some women thrive. They can do absolutely everything in all stages. And I think it's just debunking all the restrictions against women. Like, if you look at, things are changing now compared to how they were 10 years ago, 5 years ago. The London Marathon we just had, and I think there was the most amount of women that have ever run. Like, the stats are improving. I think we need to champion this. This is great and about time. So I think being told you can't do something hopefully is long gone. And I think it's just breaking down those barriers to making sure that there aren't those limitations in place and women can thrive given the right circumstances and support.
Speaking of support for women, which country is doing postpartum women's health the best?
Now, I don't know this statistically, but I think from my own training, I would say France from a medical side of things. So if you've had your child, like I think 6 to 8 weeks in their healthcare system, you have a postpartum check. Now here it's private. Yes, you have an 8-week check with a GP, but it's based on my own experience, not that great. It's getting better. And I think maybe in 5 years' time, it will be brilliant because they're asked that every GP practice now has, someone there that can do a women's health check thoroughly. But just being asked about your mental health in a sort of 10-minute questionnaire, I don't think is enough. And then just for someone having a quick look at your abdomen or down there and just saying, yep, everything's fine. It's kind of not enough at all. But in France, I think they do an internal. Not every female needs an internal, but I think you've just, be it given childbirth through vaginal birth or a C-section, like it's really important that those organs are checked.
Don't they get some form of physio as well for the 6 weeks post-birth?
I believe in France they do. I'm not sure the number of sessions you get. I think it is tailored to the individual. But I'm not sure about the aftercare thereafter, but I just think having something that is in the system as a done thing is brilliant. I think another country that's doing it really good is Australia.
Yeah, you've always said this. Australia seems to be ahead in the world of osteopathy. And
I think so in terms of our training, when I first went there like 16 years ago, I always felt when I first worked for this practice, I was actually based in New Zealand. I was with a bunch of Australian osteopaths and I felt really thrown into the deep end. I thought like, okay, right, we're all coming here with the same training. We've done the same number of years. And I felt like I was at least a year behind. And I think it's just a little more in depth in terms of what they delve into. And at the time, I think our profession has changed massively. There's a lot more integration with like physiotherapy and personal training and strength and conditioning now. But 16 years ago, for me, that wasn't the case. They've brought those things in now because it is a little bit more evidence-based than it was. But the Australians seem to kind of have that as part of their training. So for me, I was like, whoa, I need to really sort of like get up to speed ASAP. It was really good for me.
How would you describe osteopathy in one sentence or a couple of sentences? Because I think people get quite confused between physiotherapy, osteopathy, and chiropractic services. Can you explain osteopathy to start with and then the difference between the three?
So I can't, because it really depends on who you see. And the reason for that is there's the integration between all three professions, now more so than ever. Classically, you would say that osteopaths work on the musculoskeletal system and the tissues. As a diagnostic tool, they sort of try and interlink that all together in a holistic way on how to help that individual. And I don't want the physios out there to bash me, but they would be like, right, we're going to look at this from a clinical aspect on how to then rehab that patient back to health. That is not the way it is now. I know many of my colleagues who are physiotherapists who treat very much similarly to how I do. And chiropractors classically were the ones that just go in and crack and find it, fix it, leave it alone. And that's also not the case. I really now think it's dependent on who you see. The practitioner has had life experience that then helps them integrate what they like, what they don't like, to formulate a treatment that is, yes, through palpation, through diagnostic testing, seeing how someone's moving, assessing muscle function, integrating that all together. How are they breathing? How are they sort of using their body in day-to-day life? And what can you then do in a very short amount of time to make sure that they can get back to the goals that they want to do? I'm not sure if that answers your question, but it is a lot more integrated than it has been.
I think that answers it perfectly, because I think people think that they're three very separate things, but from when we've spoken before, they're not. They're all now interlaced. They all cross-pollinate so much. And I like that you say it depends on the individual rather than the type of practice or treatment or rehab that is typically associated with the title. What's one thing your daughter has taught you that your formal education didn't?
To slow down?
She sounds like her mum. What is one daily habit to support joint health?
Finding joy in movement. I can tell you to take glucosamine, I can tell you to take fish oils. They might not sit with certain people's budgets, or for some people they just might not even work at all. It might just be placebo. I think it's just, even if it's little bits of joy, that could be putting on your favourite song for 3 minutes and just dancing. That could be meditating and breathing. It's just finding little bits of joy in day-to-day life. I think that's quite important.
What is one thing you wish every woman knew about her body?
I don't think this just applies to women. I think it's people as a whole. It's just being intuitively aware of what's going on, and tapping into your intuition, I think, is really important.
How did you become interested in osteopathy, and what led you to focus on women's health?
In order to answer this, I need to go way back.
Let's go way back. We have all the time.
And when I was like in my teens, and actually way back before then, I was a classical Indian dancer. I did something called Bharatanatyam, which is a form of beautiful classical Indian dancing, and I was injured quite a lot from it. But that's actually not the reason that I was drawn to osteopathy. It was more than that. It was, I used to get really bad tummy aches. I think anxiety, stress, call it what you want. I always held it in my tummy and my abdomen. And my parents sought out quite a few different types of therapists, but it actually started back with my grandma. She was this woman that was, I don't want to call her like the medicine woman, but everything was kind of back to Ayurvedic medicine. She'd be like the one that you'd be sent to if you weren't feeling very well. You had a tummy ache, grandma's got something that she'd put together some sort of turmeric concoction with ginger and you were given it, and I didn't enjoy it at the time, but it obviously worked. But alongside that, Mum did something which it was called pechoti, which is the Gujarati word for tummy aches and the release of it. And it was a manual form of treatment that would release that tension. And they would use, like, I think betel nut leaves, and like they would heat them up and then put them on into different parts of the tummy, the diaphragm, different parts of your chest. And it would just alleviate those symptoms and allow the body to kind of heal itself, be it through getting more blood flow into the area, whatever it was. And I was fascinated by this and just how manual movement could achieve this. So I was like, right, okay, human body, totally fascinated. Biology fascinated me. And the Asian side of my culture would be like, right, okay, that's great. You're going to go down and do medicine. But I didn't really have an interest in that. I wanted to really sort of integrate more of a hands-on approach into facilitating people getting better. So I was like, okay, I think it's going to be physio. I'm going to become a physio. And at the time, I was sent to a language school and thrived in Spanish. So I was like, I'm going to be a physio in Spain. And then took a gap year. I went to Spain and I was fluent in Spanish. But learning anatomy and like medical language in another language is really quite hard.
I mean, every single word to do with the body sounds like some kind of dinosaur anyway in English, let alone in another
and
language.
I was like, no, I'm not down for that. So I worked with a physio and was in awe of everything that they were doing. But at the time, there was still quite a lot of gadgets that was needed, lots of rehab. And it was great for those patients. But for me, it was still the manual side that was missing. And I had been treated by osteopaths before, and it was just a no-brainer, you know, integrated nutrition, which was kind of what my grandma was all about, and the roots of that, with movement, which was kind of the dance element. And then it just brought that all together. So it was really in keeping with my beliefs as a child, and then as that continued.
I love it. How would you say osteopathy complements other forms of healthcare for women?
I'm biased to say I think osteopathy incorporates it really well. It is multifaceted, so we don't have all the answers, and it is really useful to also, like in our practice, we work a lot with gynecologists, with doctors, with psychologists. Like, people are supported often by a team, and if they're on medication, it's important that, you know, you're not intervening with things that might contraindicate that, or there are side effects of those medications you maybe need to just be a little bit aware of. So I think osteopathy, it can be a massive tool to just be a great adjunct in all of it. But I am massively biased.
I mean, you're also incredible at what you do.
Oh,
I've seen many corrective practitioners, and it wasn't until I came and met you and had treatment with you, and I was like, this is what it's supposed to be like, and this is the power in it. But like you say, you know, it's not just in your body, it's in everything. It's how you move, how you do your day-to-day life, slowing down. It's just the lifestyle that you can adjust and, I guess, in a way, almost optimize your lifestyle using osteopathy as a tool to help you get there.
Yeah, because it's looking at the musculoskeletal. I guess people just come and they're like, oh, right, just click my back here and it's a bit sore, so they maybe just want a little bit of a massage or some sort of manual release. And that's probably like 5% of what it's all about. The rest is kind of getting them to think about what they're doing day to day, what their sleep's like, what their nutrition's like. Now, yes, I've done naturopathy in my training. I'm not a nutritionist, but I can facilitate them to those people, or a bit more information if that's what they need. Or if it's a personal trainer, you know, just it's guiding them through how to help them or optimize the best function that they can be.
And what would you say are some of the most common conditions you see in female patients?
So women's health encompasses quite a lot. So it would be from vaginal dryness to vagismus to pelvic floor pain, sacroiliac pain. Sometimes that musculoskeletal pain isn't what it symptomatically is deemed to be. There might be something a little bit more internal that's going on if they've had maybe any abdominal surgery, not just C-section, but, you know, anything, hysterectomy, that's quite big, but anything even minor. And then it's looking at things like incontinence, bladder, bowel function, how these things are interplaying in their life. Like for some people, they don't often open up about those things. It's a little bit of a taboo. I think more women are championing it more now, and I think, you know, platforms like this, and there are so many books coming out now just encouraging women to actually talk about, you know, sexual dysfunction, hormonal issues that have a huge interplay into their pelvic health. But it's more than that. So you could say, because I treat all different ages. So from an adolescence, it's the start of menarche, the start of their periods. They got loads of abdominal pain. They can't interact with PE in school, or they're not having periods and they're really anxious about it, and it's having an impact into their skin, and because the skin is a major organ. And like the body holds the score, and it sort of keeps track of what's going on. So how can I facilitate that? And then you've got pregnancy. So you've got some people that it's not been an easy journey. You know, they might be on IVF, they've had infertility issues, they've had miscarriages. And then they've come to you, and there's anxieties that you might need to, if they allow, for you to delve in on how you can help them best. And then postpartum, which is super complex because, you know, you've heard of matrescence, this word of the metamorphosis of motherhood of the female in this new stage of her life. And it's confusing. There's a lot of information out there. I think social media platforms are fantastic, but sometimes it only gives you a snapshot of what's going on. And some of these women are like, oh my God, I need to be like this person on here. And it's like, oh, that's not real life. Let's just break that down of what we can do for you. And then you've got, you know, menopausal women. It's a bit more complex. It's
all of the stages. We are going to come on to that in a bit, but I want to touch on incontinence that you just briefly mentioned there, because this is something that I think a lot of people only tend to associate with women who have given birth, but actually a lot of people also experience this in their early 20s, late teens. I know I did. I remember when I was doing a class when I was about 18 years old, and every time there were tuck jumps in it, just rebounding off the floor. It wasn't tuck jump reset, it was rebound. I was like, I have to go pee. And I was like, but my mum complains about this on the trampoline, but she says it's because she's had 2 kids. I haven't had any children. What are some of the reasons that younger women who are yet to have children may experience incontinence, and what are some of the things that they can do to help manage and improve that?
So I think for some of those women who are quite athletic, and this isn't a blanket statement for everyone, the pelvic floor might be either too weak or too tight in various different parts. So it can be tight maybe towards like the back posterior part of their pelvic floor. So when they're doing those things, that sort of anterior, the front part of the pelvic floor, where the bladder, the uterine wall is not being supported that well. Or it could be that the surrounding muscles are too tight, and when it puts pressure into that area, especially through accumulative force, it can't retain the tension it's supposed to hold, and then it just sort of kind of all fizzles out. I think hormones play a huge interplay as well in terms of where they might be menstrual cycle based, if they've got an intrauterine device, contraception, all these sort of things. But I would say my advice would be, if they can't seek help, if they can't afford it, just tapping in to having conversations with their peers about it. If they can seek help, then I think seeing someone like myself or a pelvic health specialist, a pelvic health physio, would be worthwhile to give them the tools specifically for them if they've been assessed, to how to then recruit or switch off the muscles that need to be, so that this doesn't occur, because they shouldn't be leaking. They shouldn't be having those particular things. And I think it's great that there are, underwear now and loads of different things that encourage women to still keep doing the things that they want to do, but as long as it's not just putting a plaster on it.
Yeah, I remember someone describing it as it's common, but it's not normal.
Yeah.
Because a lot of women do experience it, which, you know, but that doesn't mean that let's not normalize it, because it's not, we can change that and we can improve that, and it's not something that you have to live with. I remember being shocked when I was told that I had a tight pelvic floor, and I was like, I've never heard of a tight pelvic floor. I've only ever heard of a weak pelvic floor before. How does it tend to differ, and are there any signs that would, other than an assessment, where a woman might be able to tell whether she has a weak or a tight pelvic floor if incontinence is something she is struggling with?
I think it's really hard to pinpoint because those muscles are so internal, you can't assess them yourself. But the symptoms, so say for example, you're running, and every time you go for a run beyond a mile or two, there's a bit of leaking. Now that needs to be addressed. And there are apps there. So there's one like the Squeezy app. I think that's used a lot, like postpartum and for menopause, that help you sort of regain function of that. There are also devices, and there's lots out there, a plethora of devices. There's ones that's like a tampon-like device that can be inserted to train those muscles to kind of come into action. That's not to say use a tampon, because that is not what you want to do, but it's just there are, you know, lots of different devices out there which someone can guide you through. Kegels, I don't know how I feel about them.
I was going to ask you about that. Does everyone need to do Kegels, or is that a complete misconception?
No, I think some people definitely do. They're a really useful piece of kit to recruit, but not everyone does, because there are so many different exercises out there, and the Kegels are not the be all and end all of it all. Like, it's tapping into different parts of recruiting your core. It's looking at your gluteal muscles. It's looking at the pelvis as a whole, and it's also just like there are lots of other platforms that this individual can access, and Kegels, I think, a part, but not the whole picture.
I mean, I feel like they were such a buzzword. So my mum is at the stage of perimenopause, and a lot of women around her have also gone through this. And I just remember every time I went home and I was with her friends, it's like Kegels, Kegels, Kegels. And they were all telling each other, you must try this app or try this. And I remember thinking at the time, does everyone need that though? Is that the kind of thing that everyone needs?
No, and I'm biased to say that, you know, I think an internal examination would be useful. It's not for everyone. Not everyone needs one. But if these are your symptoms, I think it'd be quite useful to then give you a bespoke platform on what you can then still do, but then be it a device, be it exercises, what is it that you need, be it a referral to someone else. Because perimenopausal, there's also things like, you know, uterine prolapse, vaginal prolapse. It gets a little bit more complicated with hormones and what it's doing to the tissues there. And it's just, I think it's great to just be directed on the right sort of pathway.
And then going through the kind of different stages that women go throughout our lives, which is just crazy when you think about it, how many different phases of life I guess we tend to have. How does the female body tend to change, and what support, or how does the support required differ as we go through these stages?
So the support out there is getting better. But if we look at menopause at the moment, it's still evolving. Like, I think women still need a lot of direction, and there's a lot of misinformation out there as well. So it's quite confusing. I think it is just finding, be it a good gynecologist, be it someone that's kind of got your corner, whether it is looking at your hormonal bloods, looking at support you might need through forms of HRT, through forms of natural products that are out there. I think it's asking for help. And I think a lot of women just wait, I'm not there yet. It's a bit of a flux. I'm going through something. Just going to bury my head in the sand. Oh, now I need help. Don't know really where to go. And the more people talk about it and ask their peers what's going on, they normalize it, and it brings things to life. But, you know, if I look at my own journey with regards to my little one and my postpartum experience, it can be quite isolating, and you do feel sometimes you're alone, and that you look at social media and everyone else around you is seemingly coping way better than you are. And it's not true, because the lack of sleep affects your judgment and your clarity, and you get quite occluded onto what's real and what's not, and your perception of the self starts to disappear. But the more you have those discussions and the more you're open about how you actually feel, well, I have found that people are actually like, oh my God, Anj, I feel exactly how you did. And I think I've told you before, I was reading this book, Matrescence, by Lucy Ford. And it's the first time I felt seen, and I felt like how I feel she is just beautifully posed in this book. And the more I speak to women about it and they read it, they're like, yes, I feel exactly the same. Like, I think those discussions are coming more to light now, but it's through education, through time, through platforms like this. I think it will continue to get better, but it's quite complex.
Yeah, I mean, in terms of the physical aspect of the female body, what are some things that women should perhaps be aware of or have highlighted to them in terms of things like bone density as they go through these different phases, and how can we help manage those changes?
So I think it's quite hard to sort of put that as a whole. I think if we go back to sort of like menarche, adolescence, and then sort of up into before perimenopause, a cumulative load. So if there's a cumulative load over a period of time that's causing a stress to that individual's morphology, their musculoskeletal system, then there is something called REDS, relative energy deficiency syndrome. It's when that particular individual perhaps hasn't got the right recovery. They haven't auto-regulated with regards to their nutrition, their protein, they're slowing down, listening to their body as to what's going on. They've just stressed, and then they've got a bone fracture, be it in their ankle, their shin, their hip, the most common sort of areas. And that's when you sort of need to think, okay, is this person hormonally where they're at? Are they having periods? Are they not? Have they got contraceptive devices that we also need to sort of think about too? What do we need to do to reduce that stress on that bone so that this doesn't keep happening? So with that, it's sort of working with doctors, ourselves, rehab, programs, personal trainers, looking at them as a whole on how to then prevent this, because that's not a great picture, especially if they're professional athletes also. And then later down the line, or perimenopausal, or even postpartum, the same, because the decrease in hormones is causing a similar sort of body composition to their musculoskeletal stress. And then that's causing things like osteoporosis. That's causing more of an impact on their skeletal health. So what can you do to prevent that? And I think prevention starts in perimenopause. It's how do you load? It's the importance of educating load. I think a lot of people gravitate towards like yoga, Pilates. I'm not saying there's anything wrong with that, but it's also in that week, are they able to load? Now, load can be starting off with a walk, loading that musculoskeletal system. And then maybe after every sort of 6 to 8 weeks, progressively changing that load, accumulating it, and adding a bit more of not a stress, but a bit more. So that could be on an incline, that could be ankle weights. But as long as they're changing it every sort of 6 to 8 weeks, I think that's been proven to be, optimal for what the tensile force of that tissue can take. And bone building, like I think it's incredible that the the body can adapt and change if it's given the right tools. So nutrition, like from looking from a protein, and I think lots sort of coming about how to help women more, but especially perimenopausal, like the need of that protein. I think, 1% of muscle mass is lost as soon as you sort of hit your 30s. And that's, how do you then maintain that? Like women, I think, struggle therefore more with visceral fat. And we're not just sort of looking at how it sort of looks around there, but that internal adipose tissue around their organs. Cardiovascularly, what impact does that have? Can you maybe get your doctor to kind of look into these things, manage it with supplementation? Is supplementation enough? And I think those dialogues at the start or during that process are really useful.
What would you say, because a lot of women who are at that stage of life right now, maybe in the mindset of lifting weights makes you bulky, eating less is the way forward, and perhaps quite reluctant to taking on board this incredible information that you're giving of increase your protein, add more stress to your bones and joints, jump, all of these things, but they're kind of like, no, I'm going to do, and again, nothing against yoga, but yoga and eat less, because I'm now carrying a little bit more fat and I've got a bit of, muscular atrophy, which just means you have less muscle mass. It's worn away a little. How would you help women change their mindset around this? Because some women that I've spoken to are at that stage of life are petrified of lifting heavier weights and eating more protein, because they just think, well, more is going to make me bigger. Surely I want to be eating less and moving in ways that are kind of put out in the market as making me long and lean rather than bulky.
I can't say I'm an expert, but I think the more education is put out there, and I think education for me, I don't know when you were at school, we learned about the menstrual cycle.
We hardly did.
Education was quite basic. And we didn't really, I don't remember learning about the menopause.
No.
At all. I didn't remember learning about how you could, I mean, obviously I went to a mixed school, but it's like potential ways of doing those things earlier would then have a sort of a much better, you'd be advantageous later on in life. And I think it does come down to education, and the more that's done earlier, the better. But for those particular women, it's not that it's too late, but it is really educating them for the why. So that, be it with when they're 65 or 70, they can still lead an active, healthy life, still doing and pursuing all the things that they want to do, but from a level where they're not in a hospital bed having had fractures. They're not, dealing with insulin changes that come with having more visceral fat. They're at a stage where they're actually able to pursue the benefits of all the effort that they've put into, but that's not saying it's too late. There's a lot that still can be done, and going back to the body's ability to adapt, given the right circumstances and environment, it can. And yes, of course, as you eat more protein, you're going to get bulkier. But given time and the right circumstances and loading that muscle a certain way, it will all level itself out. But for some women, I get it. I totally get it. Because when going back to Suri, not that sort of relating it to the menopause, but I had her and I was like, I'm breastfeeding, and I was like, oh my God, I'm putting all this weight on. But as a caregiver, my role is to provide for this child. So I kind of need to put those thoughts aside. But I'm like, all I'm doing is just putting weight on. They said breastfeeding would make me lose weight. It didn't. And body image and all these things, and your like internal dialogue of doom and gloom, it's raw. You could tell me to eat more protein. I'm like, I don't want to eat more protein. Like, I'm already really quite big. But energy, how I felt fatigued, I wasn't sleeping, I needed sustenance from something else. And actually having someone tell me and guide me to just think about loading and the impact that would have hormonally, for me, really helped quite a lot. I was put on like a low-level HRT after having Suri. For some women that breastfeed, this is actually quite normal. You're not producing a certain amount of estrogen. Your body kind of goes into this false menopause. And it gave me like a little insight. You know, I had muscle atrophy. I struggled to maintain a certain weight. And all of this was like, oh my gosh, okay, right, I can see how this is going to have an impact later on down the line. And it was still a year on that I then decided to do something about it. But for me, that was the right time, right place to be like, I'm in the right attitude. I feel supported. I can ask for help to then put those foundations into play. And I think for those particular women you're talking about, it's not going to happen overnight. I think it's just having those conversations, seeking help, but laying those foundations, be it over a year, be it over 2, I think it will help long term.
And I guess it's also that thing of, if what you're currently doing isn't working or helping you get to where you want to be, what's the harm in trying something new that is backed by science and may help in time you get to the place you want to be?
But this isn't a dig against yoga and Pilates.
No,
I'm a huge fan of it, and integrate practice of both in my week. I just think, and loading.
Yeah.
And sort of something that is just thinking about nutritionally what your muscles are doing.
Yeah. Okay, let's debunk a couple of myths.
Okay.
A common belief is that women should avoid exercise during menstruation and pregnancy. What does the science say?
The science has changed quite a lot. Back in the day, you were told, what was it? I can't remember, wasn't it 1975? When was the first marathon women weren't allowed to run because
I should know that. I don't know the exact year.
They were deemed as being like unfit because of their menses or not being able to cope with the same stresses as men. And a lot's changed since then. My God, look where we are now. But I would say exercise can, for some women, help facilitate and ease some of their symptoms, especially of like feeling congested and bloated around the abdomen, your mood. Like how many times of like, okay, let me just go for a little run. Let me just do a little bit of a half hour of something. You feel a little bit lighter afterwards. You work through your anger or whatever it is during that. You leave it there and you feel a bit calmer. But the science, I would say, is there that it is shifting hormonally how you're feeling by getting moving. For pregnancy, though, your question was, I'd say that is when it's a bit more variable. And each pregnancy is different. Even someone that's had their first pregnancy might not be the same as their second or third. And that's because of morning sickness. I really don't know why they call it that, because you get sickness for some women all the way through.
Just full on 24/7 sickness.
And then you've got things that you cannot control that then limit your ability to exercise. Having said that, if you've maintained a relatively good level of exercising pre-pregnancy, the evidence is there that you can sort of keep that going through. Things that you can control are there so that you can still sort of facilitate that. The only thing I think I'm a little bit cautious about is changing exercise.
Yeah.
So if you're suddenly adding more load, if you're suddenly doing things you wouldn't normally do, sometimes that can create a bit more of a stressor. So we sometimes with those pregnant women just tap into what they were doing sort of pre-pregnancy, how we can then just build on that, but keeping it at a sort of
maintenance level.
Yeah.
That's something that when I talk to people about this, it's like pregnancy is not a time to progress, it's a time to maintain. Don't fear what you were doing.
But you can still lift, you can still do your kettlebells, and if that was, what you were doing before, or running, or my gosh, of course. And some women have no symptoms, so why would you stop doing what you're already doing?
And then in terms of endometriosis, PCOS, other things like this that women tend to experience and often really struggle with, because endometriosis is not fun. How can osteopathy help with this? And what are some other things that women can do other than movement helping as well with some of this? What are other tools that women can use to help with pain management around these?
So I think we tapped into it at the start, but it would be looking at what are the inflammatory markers in their body. I'm not saying, so yes, of course, blood tests and things like that can help, but what is creating more stress in their environment, be it their work, be it a relationship, be it not enough sleep. Diet, for me, I think plays a huge role in this particular cohort. There are some foods that aren't sort of all inflammatory, but there are inflammatory foods, and there are ones that are a bit more alkaline, a bit more easier to digest, don't already add further inflammation to an area or tissues that are struggling. And I think if they can tap into that, be it through supplementation, through hydration, avoiding certain, I don't want to say this is what they need to go and do, because it doesn't affect everyone the same way, but caffeine, alcohol, dairy. Now for some women, they're totally fine with those, but for others, they can be unnecessary triggers. Fibre, there's too much fibre, not enough fibre, because what are their bowel movements like with all of this? Because the aim is to get them into some form of parasympathetic drive when everything else is angry all the time. And that can be really challenging. But the biggest help with these lot is, please edit that. With this particular cohort is the medication. What are they on? It changes from anti-inflammatory medication to, intrauterine devices, that medication that they've been put on that might be hormonal. It's really working with their gynecologist. It's working with their medical team to how best help them. So it's a bit more broader than just exercise alone.
I think the most important thing with all of this is that it's not a one-size-fits-all statement or solution with anything to do with women's health, because everyone is so individual. And then coming to the menstrual cycle, does it have an impact on performance, strength, recovery, injury? I know the science is changing all of the time, but which of those elements at the moment can you say with some certainty are impacted by the menstrual cycle, and how?
So some people, and I think now there are so many ways of tracking it as to where you're at, but whether you're using an intrauterine device, contraceptives or not, I think some women are very intuitive as to what's going on. I'd say just before menstruating, women feel sometimes at their worst. So that would probably be the best time to slow down. But then there's a surge of hormones that they're like, my gosh, right, I can do this. And they do feel stronger. They can load more. And I'd say just go with what you intuitively feel. There's so much information out there that can track, it's changing, it's evolving at quite a speed, which even I can't keep up with. And I would say before, like mid-luteal is the best time to go and do, more of your progressive load, and then think about just tapering it down a little bit. But the evidence has changed on that. And I think it is more down to the individual as to what their coping strategies are, what they're able, because life isn't, if you're an athlete and you've got to do a 200-meter race, but you're due to have your period, you're not going to sort of suddenly say, oh, actually, I can't do this because I've got to recover and just take it easy. Life isn't like that. And I think it's just going back into tapping into your inflammatory markers and knowing what can I do to optimize reducing inflammation, increasing my hydration, increasing my protein, and all of my dietary components that still help me sort of facilitate what I want to do. Because your workouts sometimes mean that you still have to progress, especially as athletes, to continue to work through.
Yeah.
But it's what can you control? Because those are the things you can't control.
How do you feel women can become better advocates for their own health in a system that often overlooks our needs?
By being, I keep saying intuitive, but by being intuitive and by having access to a bit more education. I think once we know what's going on and understand the why, I think everyone's a bit more on board as to what they need to do. And I think nowadays people are talking more, people are having sort of more discussions about how to better themselves, what, be it supplements or sleep methods, breathing methods, they need to tap into. And it's just having those discussions and sharing that information. And the more they do that, the more we'll grow together.
And then in terms of women who have had children, what would you say are some of the main things to be mindful of postpartum to look after our bodies? For example, a lot of people complain about back pain or carrying their baby on one side, constantly being hunched over because of breastfeeding. What are some things for women to be mindful of when they're in certain positions, and how can they counteract that to best look after their bodies?
I think the postpartum period is challenging on the mental and the physical. We're focusing on the physical in your question. And I would say ask for help when you can. Ask for some time out. Time out means that you can then do a bit of movement for yourself. And it's really challenging at the start. Like if I go and draw on my own personal experience, I probably until my little one was 8 months old, just felt really isolated and I didn't ask for help. And and that's someone that's had access to, they say it takes a village to raise a child. I've had a village. I've got friends and family really close by to support me. And even then, I couldn't tap into it. And so for those that don't have that, they don't have a partner, they might be doing it alone. It's finding your tribe. It's finding people that you can connect with. That might be someone down the road. That might be someone that you're connecting on a sensory class that you're taking your child to. But it's moments where you can connect with another human being so that you're not isolated. And then once that comes, I think all the other things come into play. So you're talking about the physical, be it like the carrying. I'd say, the simple things help. So in the early stages, if you can just have a moment to lie on a bed, just in that supine position, looking up at the ceiling and flat, just allowing everything and the heaviness to just sink into the bed, because the rest of the time you're on your feet and you're having to crouch over. There's so much pressure going into that lower abdominal pelvic floor region. Just lie flat, open out, take a couple of breaths, maybe put one hand on your chest, one hand on your abdomen. Take 5 deep breaths for yourself, because as a caregiver, you are constantly giving. And so it's really, and guilt interplays into this as well, but that's a whole other thing. But giving back to yourself, it's almost unheard of, but it's really important, because if you're not giving to yourself, you don't have the tools to then give to this creature you're supposed to keep alive. And then, like in my sort of practice with, like if we're sort of narrowing it down to like postural aids and things, like getting a good bra, nursing bras sometimes aren't that great. I always find on Amazon there are those clips that you can almost make like a crossback, not like a super tight sports bra, but they sort of mentally make you aware that you don't want to sort of stand up, shoulders back, head straight. No one can do that. That's actually quite uncomfortable, but it just stops that sort of need to want to just round.
Yeah.
And then movement, whatever movement that is, go and get that coffee that you want. Decaf. I mean, yes, that is another story. But whatever it is that gives you that moment of time for yourself, that you've done it in the day, because the rest of the hours you're giving. Just tap into that.
And what role do you think emotional well-being plays in physical recovery and health for women?
Oh, it's massive. Emotional well-being. I mean, where do we even start? It's a combination of having people around you to support you, because often we're our biggest inner critic, and it's having people to snap you out of whatever these intrusive thoughts might be. And if that isn't the case and it can't be your peers, then seeking medical advice. It's getting better to have access to these platforms. And I think especially if we're talking from a postpartum point of view, that 8-week check, they ask you about your mental health. That would be a point where people just kind of glaze over it. I think there are local communities, I think especially in London we're very lucky to have them, that women can tap into to really seek that community guidance to help them through that period. But I think the aim of what you're sort of asking is just finding people to help you through challenging times, because it's really, really isolating when it's just by yourself. And it doesn't have to be exercise platforms. It's just speaking groups, other baby groups. For me, I found that other baby groups really challenging. It didn't feel like I fitted in. Kind of felt like being at school again.
Yeah.
So for me, it was just feeling normal, taking myself back to how my life was pre-Suri. That's not to say I wanted that, but a tapping of right, I'm going to go and do some exercise in central London. I'm just going to take myself out of this community and go back to what makes me feel whole again, so that when I go back to her, I can give her 100% of me.
Yeah, and I think that's so important. When I spoke to Miranda about this as well, of mum guilt that can sometimes come away with taking some time for yourself without your child, and how did she manage that best? And she said, that time is just so important for me. I can be a better person and a better mum after having had that hour, 2 hours, however long it may be, to myself, and then come back and give in the way that I want to give to my child, but may not be able to if I don't take that time for myself. Have you encountered any cultural or societal pressures that affect how women approach their own health?
Coming from an Asian background, definitely cultural barriers. A lot has changed, and progressively for the better. But I don't know if you've spoken to sort of many Asian women, but when you are menstruating, when you're on your period, and there was a holy event or something auspicious to celebrate, you weren't allowed to go, because you were defined as being dirty and impure. And that has changed and is continuing to change. But that language about being dirty, and I think this isn't the only culture that I think there's lots of books that lots of cultures are sort of, I think tribal ones where they sort of go off into a different tent and then are integrated back into society once they're not bleeding. There's a really good charity, it's a friend's charity, and it's called Dignity Period, Binti Period, and it's about having a dignified period. And they're talking about getting platforms into schools and educating, especially where there's strong Asian culture, talking about this is not dirty, you are not seen as impure, this is normal, and having those conversations and providing good sanitary products for those communities where you are sort of told to hide away. But yeah, I'd say culturally that was my biggest barrier, was it was almost shame was brought upon this thing that you're going through. And then it would be, well, I saw it as a get out of jail card for loads of things. I was like, okay, I'm not going to do PE.
Yeah.
Because why? What's the point? Back then, you could have a little note, and you were allowed out of PE. And now, it's not. It's sort of, it's all normalize, because the education is there and the education is getting better, that you can do whatever you want to do. This is not a limitation. Yes, you can plan how you're going to do things and stress that over time. That's later on in life. But this is a time where you can thrive and still do whatever you need to do. It's the education to provide you, I would say, confidence when you need it most.
Yeah.
And I think in those integral years as a child, because that wasn't there, I had to find it from different avenues and then question, well, hold on, why? This isn't how I should be feeling. I don't need to be shamed about this. And I think for me, that was when I wanted to sort of like create a bit more of a platform into getting women to talk, getting women to share experiences and normalise how they felt.
What is one thing that you would love to debunk as a working mum and people's perceptions of working mums?
Guilt. You mentioned before about guilt, and it's like mum guilt is there. And actually once I myself have accepted that what I used to do like in terms of osteopathy in my job was give my all to everything I was doing, and that was what I saw as success. Like if I've given my all and I have given my patients everything, and I still do that, I'm not saying I don't, but my priorities have changed. And as long as I'm creating a bit of balance with family life, for Suri, for myself, then I've succeeded. And if I get guilty about not being able to perform at work and I can't then juggle what I'm doing at home, and I'm trying to be the best and kind of juggle all these balls and be the best at everything all at once, that's when I think I was so hard on myself. The guilt's there, those intrusive thoughts are there, and I can't do it all. But stepping away and just knowing that if I can create balance in my internal home prioritized environment, everything else kind of slots into place. And people see that as sort of face value for what they're going to get from me as well, then that's okay.
If you had one piece of advice for your younger self, what would it be?
Probably would have started looking at my diet better. I probably would have, looked at training and diet a lot better, like protein. I was always on about like not starving myself, but like nutritionally calorie deficit. I don't need this. I'm just going to look a certain slim way, and that is what society wants. And then I look at my mum, and she's got osteoporosis, and there's loads of women in the family that do suffer with bone health issues. And actually, if I'd started younger and saw all of that as integral for the later me, then... But as I said, it's not late. It's just if I could go back and just educate myself on that would have been really useful.
You have been so brilliant. Thank you so much for coming on.
Thank you for having me.